Hi, Ms. Smith.
Yes.
Hi, I'm Dr. Yulo. I'm here to talk to you about your results from today and your plan for discharge.
Hi. You can just call me Jen.
Okay.
I wasn't even sure if I should come in, but it just didn't feel right.
Well, I'm glad you came in. We're here for you anytime that you need it in the emergency department.
Well, thank you for coming to talk to me, but I still feel really nervous about this. Are you sure that it's okay for me to go home?
I understand that you've been having an asthma attack for the past few days. Is that right?
It started a few days ago, maybe 3 or 4. I had shortness of breath and chest tightness. It was worse at night. I was coughing a lot, and I could hear wheezing when I breathed.
I see. Well, the good news is that everything came back normal from today, and we should be able to discharge you back home. Does that sound okay with you?
Well, I'm glad that everything is okay, but I've had asthma since I was a kid, and this just doesn't feel right. Usually, I use my inhaler, and it helps, but this time it just didn't work as well. I don't know how to describe it. It's just harder to catch my breath.
Can you tell me a little bit more about that?
Well, I use my albuterol if I'm feeling tight or wheezy, and I've only ever needed steroids once or twice. The last time was 2 years ago. I try to avoid taking anything stronger unless I really need it. Look, I know my body pretty well, and I can usually tell if it's just asthma.
Well, I agree. It sounds like you know your disease and that you know your asthma very well. The good news is that everything came back reassuring, and we should be able to get you home and you don't need to stay in the hospital.
Okay.
I can sense that you're still a little bit worried about your breathing. Is there anything else you can think of that might be going on or contributing?
Well, I just moved here for law school, and it's been a really tough transition. And usually, if I have an asthma attack this bad, my family's around to help.
Well, first of all, congratulations on getting into law school. That's an amazing accomplishment. But I can totally understand how stressful it might be to not be feeling well and to be in a new environment without your support system.
Yeah, I think that's playing a role in this. So, the wheezing went away after the nebulizer?
Well, your breathing got much better after the nebulizer treatment, and the nebulizer helped give medication to your airways and open them up and relieve some of that chest tightness that you were feeling. Does that make sense?
Well, yeah, that all sounds good, but what do you think is going on? I mean, what about the x-ray?
Well, your x-ray also came back normal. It doesn't show any signs of pneumonia or an infection in the lungs. Your oxygen level from your finger also came back normal. And we did some blood work today to make sure that you don't have anything dangerous like a blood clot in your lungs or stress on the heart. So I think this was probably just an asthma exacerbation that improved after the nebulizer.
Well, I was really worried that it was something serious. If I can manage this at home with my inhaler, and maybe if I have a plan for what to do next time something like this happens, I think I would feel better about going home.
Well, that's great. So what I would recommend is that you use your inhaler at home. You can give yourself 2 puffs every 4 hours as needed for wheezing or chest tightness. I'd recommend that you take it easy for the next few days and avoid any triggers like smoky or dusty environments. Do you have your prescriptions at home or need any refills today?
I have my inhaler at home, but do I need to do anything differently, or do I need to see anyone after this?
Well, anytime you're seen in the emergency department, we always recommend that you follow up with your primary care provider. And what I can do for you is put all of that in the discharge instructions. It was really nice to meet you, Jen.
I know you have other patients to see. Thank you for taking care of me today.
Of course, no problem.
Bye.
Take care.